Professor Ihab Attia, Secretary General of the Working Group in Preventive Cardiology in the Egyptian Society of Cardiology. حضرتك اديت two talks في المؤتمر. I would like to have a highlight about the two talks, please.
Sure. The first talk was introducing what we call the novel or new oral anticoagulants to prevent strokes that happen related to atrial fibrillation, because this is an important issue. We have been treating patients with atrial fibrillation to prevent stroke with what we call vitamin K antagonists or warfarin for years. This has been the drug of choice that's been going on for decades. And it's got a lot of limitations, and mainly the limitations are the difficulty to get the patients within the therapeutic range, what we call a narrow therapeutic range. So majority of patients in clinical practice are either under anticoagulated or over anticoagulated, so they are not protected or they are liable to excessive bleeding, mainly hemorrhagic bleeding in the brain leading to intracranial hemorrhage. So the difficulty of getting these patients to the therapeutic range entails they have to frequently monitor their anticoagulant level in the blood, but what is known as the prothrombin time or INR, and at the same time they have to adjust their dose repeatedly. It is very cumbersome. Most patients do not do it. Most laboratories, unfortunately, are not very accurate, so they give us false readings, and we end up having the patient either not protected or bleeding, which is not the target. So the idea came to develop these new oral anticoagulants that do not require frequent monitoring. They have a fixed dosage given. They have the same efficacy. That was the main idea of the trials, to prove that they have the same efficacy like warfarin with fewer side effects, meaning greater safety. And the trial that I presented today, known as the RELY trial, was the first of these trials. There are two other trials with the two other new oral anticoagulants known as the Rocket atrial fibrillation and the Aristotle trial, dealing with two other agents, and they're all new, and they all proved to be non-inferior to warfarin, meaning the same efficacy with more safety, less intracranial hemorrhage. So the safety is more, efficacy is the same. You don't need to monitor the prothrombin time every 2 weeks like we do. We give it fixed dosage, and it gives convenience to doctors and physicians. What was good is that the guidelines adopted these new oral anticoagulants, and the recent update, Focus Updated 2012 of the European Society of Cardiology, showed that they are kind of like the preferred choice in patients who have what we call a high SHADS score, which is a high score for strokes and systemic embolism, and those who have a low, what we call has-bled score, low incidence of developing bleeding. They should preferably go to these new oral anticoagulants rather than the old gold standard, which was warfarin. So this was mainly that first presentation. The other presentation was about the role of thrombus aspiration in primary PCI. Patients who present with acute myocardial infarction have a thrombus that is resistant, and you need to clear the way in order to go and stent the artery. So you use mechanical aspiration. There are two types. There are the direct thrombus aspiration, and there is the mechanical types like the angiojet with a jet under high pressure to kind of disintegrate the thrombus, as well as other mechanisms. So this was just giving an idea of the limitations and the advantages of using it. So these were the two presentations.
Professor Ihab, بما ان حضرتك الchief of the working group of preventive cardiology. ايه هي الاكتيفيتيز بتاعت الوركينج جروب اوف preventive cardiology على مدار السنه، وكمان ايه هي الاكتيفيتيز especially in cardio Alex في الوقت بتاع cardio Alex؟
Besides cardio Alex, around the year we have targeted. We have a very active young participants in our working group who are actually doing education in schools, and we are now approaching universities to give education to young
junior doctors.
Because we're trying to educate the students to give them simple ways how to eat healthy, how to prevent, because if you want to really prevent, you have to prevent from school age. After this, it's too late. So we are going to there. We are at the same time doing screening and advice in, like we say, clubs, sporting clubs. We evaluate their lipid profile, blood pressure. We give them a talk about preventive measures. We discuss
awareness campaigns,
and screening to give them, in addition to awareness, active steps, what they need to do, what steps they have to do. Besides this, we have our meeting yearly. We have the Cardio Prevent meeting. We have it in November or December each year, depending. And this year was the first time we incorporated sports cardiology, because cardio prevention involves cardio prevention, rehabilitation, and sports cardiology. And it was the first time to give presentations about sports cardiology for professional athletes, how to screen them and how to limit those that are at risk of dying suddenly, like the players who die in football matches within sudden death inside the lab, inside the
field,
stadium.
Yeah.
So we are screening them. They have separate tests to be screened rather than those who do recreational sports. Athletics have to be screened very meticulously, and this we presented. We presented rehabilitation after surgery, after infarction, after heart failure, and this was again the first time in the meeting to be presented separate. We included specialists from andrology to talk to physicians to tell them how we approach patients who have andrology problems after their heart attacks, psychiatry, and nutrition. And we got specialized nutritionists, andrologists, psychiatrists. So this we gave awareness in our meeting as well. Regarding Cardio Alex, we have sessions dispersed all over the meeting, tackling cardio prevention with the regular ways, blood pressure control, dyslipidemia control, as well as promoting good control of diabetes. We have rehabilitation sessions that is being covered very well. We had a talk presented by Dr. Ghada Slim, who gave the experience of Ain Shams in cardiac rehabilitation. And these are actually pioneering rehabilitation in Egypt, and it's spreading. And we had yesterday an interesting educational program about smoking cessation, which was in collaboration with the World Heart Federation.
Yes, I was going to ask you about the work, the smoking cessation workshop with Dr. George Saida, yes, in the WHF. What about it? Well,
they are pioneering a program to promote awareness first for smoking cessation and to take active steps, because like we said yesterday, to do smoking cessation first you have to ask the patient, you have to advise him, and you have to help by giving. There are several agents that you can give help. It's not enough to tell him stop smoking. You have to give him something like a nicotine replacement, which is by various means, patches, nasal sprays, gums, and you have to use also drugs that act on the centers that will give the patient confidence, because they will fight the craving. They will fight the craving for nicotine, because nicotine is very addictive. It's an addiction. When you take the first puff, it goes to the brain in 7 seconds. 7 seconds. It's faster than any drug you can find. And this is why the companies, all these cigarette producing companies, they know they have reached the best formula with the best filter that immediately when the smoker takes the first puff, the nicotine reaches his brain cells in 7 seconds. And this is why it is addiction and it's very difficult to leave. So we're giving advice, the agents to replace nicotine and the agents to stop the craving. And then follow up, monitoring, follow up this patient that he cannot go back again to smoking because the relapse of smokers who stop within the first year is more than 80%. They go back to smoke. So this program was to give them, the physicians who are interested, the launch, and they are supposed to educate other physicians in Egypt and to start with the material that will tell them which patient will have the nicotine replacement, which one will have the drugs that will stop the craving, and it's educating them about side effects because there are some side effects, they have to know them.
Side effects for stopping the smoking.
Side effects for the drugs as well that you give to stop the craving, because most of them in patients who are prone to depression, especially those who are prone to extreme cases like suicide attempts, they should not be on these agents. So we have to evaluate such patients. You have to give them in an up titration dose, carefully monitoring them for a prolonged period, talking about 3 months. And this is the best chance they get to really stop smoking, and you have to follow them afterwards to make sure they're still stopping. So it's not enough to spend 5 minutes in your clinic telling him you have to stop smoking. If you don't have except these 5 minutes, that's the message we told them. Okay, advise him, but refer him to a specialist who has the time.
Follow up.
And this specialist could be a nurse, not necessarily a physician, that is trained to follow up with the patient to make him stop smoking, prescribe the agents and the nicotine replacement. So it's still a new program. The World Heart Federation are serious. They want us at least to promote smoke-free areas in hospitals, in restaurants, in public areas. Because of the information we got yesterday is that passive smoking kills millions every year, like 11 million worldwide, just by sitting in a smoking environment.
Area, yeah.
So passive smoking is very dangerous, especially for example, women who are at home living with a heavy smoker, and the children. The children are affected. So we are giving this message because if you don't care about your health, there's no need to kill your family by smoking, because this is what happens on the long run.
Professor Ihab, thank you very much for your participation, and I hope you enjoy cardio, Alex. Thank you very much.
Thank you.